I'm Dr. Michael Passmore, Clinical Associate Professor at the University of British Columbia and the Medical Director at Encareage. Today I'd like to continue our series focusing on caring for elderly relatives at home. Today we're going to talk about a topic that's really important when caring for an elderly relative: organizing their medical information. Before we begin, however, I wanted to remind you that the information shared in this series is intended for educational purposes. If you have questions regarding your own health or the health of a loved one, please discuss this with a healthcare professional. As family caregivers, one of the best things we can do is to help our loved ones manage their medical history, medications, and medical appointments. Doing this not only improves healthcare efficiency, but can also help avoid complications down the road. To illustrate how organizing medical information can make a big difference, I want to share a fictional story about a woman named Jill and her elderly father, Frank. Frank is in his 80s and has several chronic conditions, including diabetes and high blood pressure. Over the years, he has been to countless doctors and specialists, and as time went on, his medications increased, and keeping track of all of this information became quite difficult. Frank didn't always remember the details of his past medical history, his family history, or frankly, no pun intended, even the names of the medications he was currently taking. It wasn't until Frank ended up in the emergency room one day with a bad reaction to a new medication that Jill realized just how disorganized his medical information had become. The doctors at the hospital asked for a full list of his medications and his medical history, but Frank could really only recall bits and pieces. This delay in the information made it harder for the medical team to quickly pinpoint the problem. After that scare, Jill decided to take action. She sat down with her dad and spent a few days going through all of his medical records, medication prescriptions, and past medical appointment notes. Together, they created a medical binder organized into a few key sections that made things much easier for future doctor visits. Here's how Jill did it, and it's a simple process that can help you organize your loved one's medical information as well. Step 1 is organize notes about past medical history. Jill gathered all of Frank's medical records and made a simple list of his past diagnoses, surgeries, and hospital admissions. She also added some notes about his family history, especially conditions that were particularly relevant to his active issues like heart disease and diabetes, which both ran in the family. Step 2 is current medications. Next, Jill created a medication list that included the name of each drug, dosage, frequency, and the reason that it was prescribed. She made sure to update this list whenever Frank's doctor adjusted his medications. Step 3 is looking at upcoming medical appointments. To avoid missing important checkups, Jill used a calendar to track Frank's upcoming medical appointments. She also kept a list of his healthcare providers along with their contact information in the front of the binder so that it was easy to reference. Step 4 is emergency information. Finally, Jill created a one-page document with Frank's critical health information like allergies, current medications, and emergency contacts. This document went in the front of the binder, making it easy to pull out in case of an emergency. After Jill helped her dad get everything organized, doctor visits became so much smoother. During one appointment, when Frank's doctor needed his full medical history, Jill simply handed over the binder. The doctor was impressed with how organized everything was, and it saved them time during the visit. Plus, it gave Frank peace of mind knowing that his medical information was all in one place. Having your elderly loved one's medical information organized like this not only helps doctors make quicker and more accurate decisions, but it also helps you as a caregiver avoid unnecessary stress. You don't want to be scrambling for information in a medical emergency. Being prepared is key. If you're in a similar situation with a parent or elderly relative, consider starting with these simple steps. Whether you use a binder, like Jill did, or an app on a smartphone to store the information digitally, the goal is to make sure everything is easily accessible when it's needed most. So that's it for today's episode. I hope you found this story helpful, and I encourage you to start organizing your loved one's medical information if you haven't already. It's one of those things that can make a world of difference down the road. As always, if you have any questions or need support in your caregiving journey, feel free to reach out to us here at Encareage. If you're finding this series helpful, I encourage you to like and subscribe to our channel for future updates. Also, please share it with someone else who might benefit. For more support and resources, please visit us at encareage.com. Join us next time as we delve into another important topic in caregiving. Until then, take care and be well.